Hey, this is Dr. Brian McKay at Core Health, and I want to talk to you today about the Back Pain Project. Now, the Back Pain Project is kind of a big sounding name, but actually it really is a pretty cool thing because what we're trying to do is we're trying to make treating back pain a little bit more scientific using really the most cutting edge therapies. And um, to give you examples, one of the things we're using is shockwave therapy to break up adhesions and scar tissue that forms. You have to think about it. In a chronic low back case, someone's had back pain for a long period of time, you're going to develop scar tissue, even micro scar tissue. And it really makes it harder for the underlying tissue to work effectively, especially the discs and the vertebra. So you have a disorganized pattern. It's kind of like a patch job. Like I don't know if you've ever seen somebody patch a ceiling or a hole in the wall a bad way. Well, it's not a beautiful thing. When you get someone to come in, they do a nice job of patching up, sheetrock and cement. It makes it a lot nicer. So what happens is you don't have that nice organized thing because your body's trying to buttress an unstable area. So with the shockwave therapy, we're able to do is send upwards of 2 to 3,000 shocks in. That one stimulates blood flow, but two breaks up the adhesions. And my initial response thus far has been pretty incredible because the adjustments post are off the charts. I mean, I'm getting the results that I'm getting with my manual chiropractic treatment by using shockwave therapy are just enhanced. There's a multiplying effect here. So it's pretty cool when after being in practice as long as I have, which is close to 30 years, that you can say you get excited, but this is a real good addition. So the back pain project is one. We're pulling in a whole new way of breaking up adhesions. Now listen, as a chiropractor, I always got to pull the chiro mode and say, yeah, the chiropractic treatment's the most important thing. But it's really when you find the most effective stuff. That's really when you combine a series of effective things. So I wanted to talk to you now about the Back on Track. Back on Track is a super, super. Now, this in addition to shockwave, it's a traction unit that just blows away other traction units. Now, if you've had a bad back, you've heard about spinal decompression. Well, if you haven't, well, I'm telling you about it. I got started in spinal decompression probably 22, 23 years ago. So I have a good level of experience. Now, spinal decompression is great, but they've come up with a new machine to decompress a disc, and it is impressive. I'm telling you, I am like floored that I'm sitting there going, I just got the machine in, and I've seen it before in action, and I'm telling you, it is a phenomenal thing because you can do so many different things. And this is probably where you're gonna get bored if you want to turn it off. I mean, this just to give you an example, static axial traction is where you open up the joint in a long axis. Okay, so we kind of make upper to lower. And what that does, it separates the joint. So if you're having tension on the nerve root, that's going to release some of it. Then you have what's called graduated, intermittent axial traction, and this is where it goes in steps. You go like say you want the traction length is just for argument's sake, say it's 6 inches. Well, you're going to go 1/3, you go back a little bit, then you go 2/3, then you go back a little bit, and then you're going to go the rest of the way, the full length, and then back a little bit, and then start all over again. So that has kind of a milking action to the joint, which is has profound effects because it can really make things feel a lot better. Um, then there's repeated axial traction where you can go, full length, come back a little bit, and then go, and you just keep doing that. It's a repetitive thing. But when you have so many different options, like because static axial traction with lateral flexion on the right, and you have 10 degrees and um, you know 20 degrees. You're really splitting hairs, but your treatment is just going to go through the roof because you're making a powerful difference. I mean, so it's not just the chiropractic part. You really have some great stuff here to totally get in and attack this thing. To me, it's like a mind bending thing. How great this particular thing is. You could, because you take an MRI and you see where the intervertebral foramina is where the nerve exits the spine, and so either on a not so much the lateral view, but we call them oblique views on X-ray or with MRI, you can see which foramina is being encroaching on the nerve root, and you just open that thing up using this treatment. Now, again, as a chiro, I was going to say that of course the chiropractic adjustment is going to be a big part of it, but let me tell you something. This is huge. Kind of like a game player. Um, you have so many different ways of making this work and to your benefit. So it's like when you come in, now I'm going to throw you another thing that to me it just blows my mind. The back on track machine, like I said, I've been doing decompression for 20, 22 years now, but the fact that it also has a vibratory effect. Now, you may think vibration, hey, it's like a massage, but it actually stimulates the nerve going up to your parietal lobe, which is it's so what? Yes, it feels good, but it's not just feeling good. It's about really making a change, like waking up the brain. Because listen, everything's connected. That nerve, that painful nerve in your lower back, goes up to your brain, and the brain sends a signal down. So when it's getting like funky signals for a long period of time, saying, "Hey, this person's in a lot of pain," now you got a way to change it. It's phenomenal. I mean, I'm telling you, the treatment going forward. So so it's just amazing. Now, the other thing too, as far as the back pain projects, we got, of course, my chiropractic adjustment. Got to put that plus in. We've got shockwave therapy, the back on track traction, spinal decompression unit. Now, what else do you add to that? Laser. A laser heals a nerve. It really heals it and ramps it up. So we're able to really cut treatment times down tremendously. Where you come in with a chronic back case and, 8 to 10 weeks later, the person's walking out. I'm not saying with a brand new back, but they're coming out in so much better shape. So much better shape. So what I'm going to encourage you to do is if you got any questions on back pain, I kind of geek out at this stuff because it really is like something I'm excited about. But the back pain project is really, I think, going to change, like especially someone say you have had failed back surgery. I think it's going to be having a profound effect on the quality of people's lives because it's not just chiropractic. Sometimes chiropractic doesn't work. Sometimes physical therapy alone doesn't work. When you take the latest technology and use that to apply and fix someone's back issue, I think you're going to see incredible results. So I'm excited about it and I'm happy to offer it. Dr. Brian McKay, Core Health Darien, the Back Pain Project. If you have any questions, 203-656-3636, 203-656-3636. All right, have a great day, and thanks for listening.